What Gwyn Bevan and his colleagues have done is demonstrate over a decade or so what government policies work and what reforms of the public services work by comparing what they call the natural experiment of England with Scotland and Wales after devolution. And it's got some very, very clear messages for public policy, for government and for the public services.
It started out not as research, but as work for the Commission for Health Improvement, which was the NHS's first quality regulator. I was seconded from the LSE to work for them in 2000, and we got involved in the new system of performance management known as the star rating of the National Health Service in England. The four models we've identified are the first common one that's used in public services in trust and altruism, which basically you believe that people who work in public services do the best they can and do not need sanctions and rewards. A second is targets and terror, where you hold boards and chief executives to account for performance, and if you fail, you threaten them with a sack. The third is naming and shaming, where you publish performance in such a way that the reputation of poorly performing providers is damaged. And the fourth is choice and competition, where, for example, you give parents choice of schools and patients choice of hospitals, and the funding of schools and hospitals follows from those choices.
He did a lot of work on targets in health and the impact of targets on health. And it was kind of important in three different ways. One was he demonstrated that targets had a real impact. But second, he showed quite clearly that they only had a real impact if they were followed up. So just setting a target on its own does not produce an answer unless you performance manage it. And he did that by a rather neat research method, which was to compare England to Scotland and Wales, because we now have three different types of health service in the UK. And he showed that in England, because they were followed up with what became known as targets and terror, in other words, managers were followed up to make sure they were hitting these targets, they had a real impact, whereas when they were simply introduced as numbers, in Scotland and Wales, nothing happened until they, later on, probably as a result of Gwyn's impact, started to performance manage them as well.
The government in England, for its National Health Service there, moved away from this system of rewarding failure to one which sanctions applied to failure. So threats of chief executives were threatened with a sack if they were deemed to fail, and the hospitals were named and shamed for failing in performance. The other countries continued to reward failure, and what we found was there was a transformation in performance of the English National Health Service that was not matched with the other countries, for example, in waiting times.
The impact of targets was an important part in waiting times coming down from well over 18 months to down to 18 weeks currently, pretty much. Now, you could argue it wasn't just targets that did that, but they clearly were an important part of what was a very big change that hugely benefited patients.
There's two examples of governments adopting policy in part based on Gwyn's work. One is in the education system in Wales. When Leighton Andrews became Education Minister about 3 or 4 years ago, he took an approach explicitly modelled on what England had done. Similarly, more recently in Scotland, inside the health service, they set up a delivery unit modelled on the delivery unit that I ran in England, but this is inside the health service, and that's begun to help Scotland catch up on waiting times with England.
The crime story is an example of a general problem, which is systems of holding people to account for measures of performance will tend to result in gaming. It tends to be much more problematic in crime than in schools and hospitals. But it does mean that these systems, to be effective, you need to have a good system of regulation to counter gaming. We can now see that mixing with a system in which you hold boards to account and a process of naming and shaming, these work well together because you're both motivating the top to respond and those within the organisation to also respond.
The really significant finding from Gwyn Bevan's research is that being clear and focused on a small number of targets, pursuing them relentlessly, using transparency, ranking, for example, hospitals, makes a big difference.
The immediate impact was to contribute to a body of scholarship to which others have contributed as well, looking at the natural experiment across the countries of the United Kingdom, looking at schools and health services. In terms of government policies, what that's led to is a change in performance management in Scotland, where they've been much tougher on poor performance, and the performance in Scotland has improved to match that of the English NHS. And in Wales, the studies of looking at school league tables have put pressure on the government there to try and devise a system of public reporting to improve school performance in Wales. In England, the government, the coalition government, decided to abandon public reporting and rely on markets. They now want to move away from that, and my research and others have contributed to their thinking about how they assess performance of the English NHS.